The issue of undocumented residents in Illinois continues to strain resources up in Chicago, with non-citizens coming from the southern U.S. border being transported to a sanctuary city and a sanctuary state like Illinois and Chicago. And you've already seen the tens of millions of dollars being allocated to help house those migrants, not just from the city of Chicago, but also from the state of Illinois taxpayers. But there's also the issue of non-citizen health care that taxpayers are set to subsidize further after already having subsidized non-citizen health care in Illinois. So just some background. Back in 2020, during the pandemic, there was a measure implemented that allowed for taxpayers to cover the costs for health care of non-citizens in Illinois over the age of 65. It was estimated to only impact around 900 people, and the sponsor of the bill said it would just cost a little over, $1 million. I think it was closer to a $2 million estimate. That was in 2020. And then in 2022, the program is expanded to include adults over the age of 42 who are non-citizens to access that program. And then you had an audit project the costs to be more than $1 billion in the fiscal year that starts July 1st. And that caused Governor J.B. Pritzker to, number one, work with the legislature to find some cost controls, and number two, to implement those cost controls. So after the governor signed the budget up in Chicago earlier this month, he was asked about the overall costs of what it's going to cost taxpayers to fund non-citizen health care, and just how exactly the costs are going to be controlled. Here's the governor.
So let me begin by saying that there are two different populations that you're referring to one, which is undocumented immigrants. And then we have what some people refer to as migrants or asylum seekers, totally different population. Those people are here, they're documented. They're here legally in the United States. We have undocumented people who are in need of health care, and that's what that program is designed to address. And I'll talk about that. I just want to make sure we're talking separately, because sometimes, not you, but sometimes people conflate the two. So in February, we took a hard look at that program and saw that the continuing number of people who are signing up for that program was rising at a very rapid rate, more rapidly than people anticipated when the program was put in place. And so we had to take another look at our estimates of costs based upon that rapid increase and the amount of services that were being used in each of the cohort groups from 42 to 55, 55 to 65, and 65 and over. And make sure that we understood what the cost really was going to be. So this idea that we were spending $1.1 billion and that now we're going to have to cut the program in half, not accurate. We were estimating going forward what the program is going to cost in FY24 if we didn't make sure that we were managing it properly. And we needed some tools in order to do that. So we went to the legislature to ask them for those tools. I had already put $220 million into the budget to cover that program. Remember, we save money when we invest in health care for undocumented immigrants, because you know what happens if they don't get health care, basic health care? They end up in an emergency room, and we all end up paying for that at a much higher cost than if we have preventative care and regular care for people. So we had $220 million in the program already, and we realized that if we could manage it properly, we could manage the program with the number of people that are in it now to about $550 million. That's more than we expected, but not nearly as much as it might have cost if we didn't have the tools necessary. So we'll be working on that over the coming year and making sure that we meet the budgetary goals.
So again, Governor J.B. Pritzker laying out that he's going to have some cost controls. This was earlier this month when he signed signed the budget, saying that, yeah, it was estimated to be $1.1 billion, but now they're only capping that at $550 million. So how do you get from $1.1 billion estimated costs for the coming fiscal year to trimming that down to $550 million that taxpayers are going to be on the hook for? Well, the governor's administration on Friday announced a update to the rules. We'll go through those and hear from State Senator Jason Plummer in reaction to those rules. And just a bit of a preview, he says the governor can't put out a fire that he started. So we'll touch on that. All right, back at it, talking about the program that funds non-citizen health care in the state of Illinois. It's been around since 2020 for people 65 and over in the country as non-citizens. And in 2022, they increased the program to include 42 years old or older to get those taxpayer-subsidized health benefits. So the governor signing the budget earlier this month and ultimately saying there are going to be some controls there. Well, Friday, the Pritzker administration, they announced the 42 to 65 program will be suspended next month, saying per enrollee costs have tracked higher due to more prevalent unrelated chronic conditions and higher hospital costs. I reached out to State Senator Jason Plummer to get his reaction to this program and the governor pausing it, and here's some of what he had to say.
Right. Well, I think this program is, a great example of how a lack of thoughtful policy puts a lot of people in a bad spot. I mean, this program was rolled out in a very haphazard way. It wasn't well thought out. I think that people were not straightforward in terms of the costs. And now that the reality of those costs are hitting those same people right between the eyes, they're kind of adjusting at the last minute. And the problem is, what does that do to our hospitals? What does that do to the taxpayers of Illinois? What does that do to people who are legitimately seeking health care? And it puts all of those organizations combined while the governor, tries to, do damage control politically. It's just unfortunate. We need to think about long-term policy solutions, not these haphazard fits and starts.
So the governor, again, saying when he signed the budget, it's estimated to cost now with the controls that he could have in place around $550 million, which is half of what the estimated cost would have been if there weren't cost controls in place. Senator Plummer talking more about the overall taxpayer cost.
Well, this is much more than a state budget thing. And so what I mean by that is, we've sent out this messaging that, we're going to have the greatest gold-plated health care of all 50 states for illegal immigrants, right? And we sent this message out, and we've begun to sign people up, and now we're attracting people like a magnet. And naturally, if it's healthcare related, some of those folks are going to be folks that, have real medical needs, sicker end of the population, let's call it. And all those folks are here, or they're still coming. And sure, state government might say, well, we can't sign you up anymore. But obviously, if they're going to show up at a hospital, if they're going to show up at a facility for healthcare, they're going to receive healthcare. And the hospitals are going to be forced to bear that cost. And naturally, the hospitals are either going to go out of business, or they're going to pass those costs on to folks that are paying for the health care, Illinois citizens. And so, the governor and his political allies might be looking at this from a state budget solution standpoint. They're not helping people, documented or not, who are seeking health care. They're not helping the hospitals. They're not helping the taxpayers of Illinois. It's politics ahead of public policy, and we need to get rid of that in Illinois.
So Plummer talking about how even with a pause of the 42 to 65-year-old program starting July 1st, you also have the governor's administration saying they'll pause the 65 and up program if it gets over a certain threshold. I think like 16,500 individuals that might take part in that. But Plummer says, kind of equating what the governor said, that if we don't have preventative health care, then it's going to compound the cost if these people have to go to the emergency room. Plummer says, again, that's going to cost taxpayers and hospitals one way or the other.
It's absolutely going to compound the problem. The governor, is trying to put out a fire of his making, and he's not going to be able to put it out. And the reality is, Sure, I don't know anyone that doesn't want people to receive health care, but we have to be thoughtful as to what we're doing to the state budget. We have to be thoughtful as to what message we're sending to various populations. And the message Illinois has consistently sent is, come to Illinois, we'll pay for everything. And now the governor recognizes that he's either going to bankrupt the state or he has to quit doing that. And so he puts a stop on it. But folks are still coming. Folks are already here. And now it's going to be a burden on our hospitals, who are either going to, be put in an even worse fiscal situation than they're already in, thanks to, what the majority party did to them in the budget, or they're going to pass those costs on to Illinois citizens and the folks who are showing up for health care and paying the bills. So it's just driving up costs for everyone, and maybe the governor thinks he's saving the state money, but he's really just offsetting those expenses because of his public policies. They're going to be accrued by somebody.
Again, we're talking about the program that offers taxpayer subsidies for health care of non-citizens in the state of Illinois. Non-citizens who are here because, well, the state's a sanctuary state, meaning the state does not honor immigration detention orders if that's the only thing that ICE wants to go after an individual over. So that, Plummer said, is a policy that Illinois has enacted, and it's attracting more people to Illinois who are non-citizens, and thereby, when you have that, that's one thing, but then if you have it stacked on top that they're going to get subsidized health care, that's going to be a magnet, and policies that Plummer says make things tenuous for taxpayers.
That's a piece of it, right? Which obviously drives, education costs, healthcare costs, housing costs, law enforcement costs. It drives costs across all layers of government. But there's also a difference between being a sanctuary state and being a sanctuary state that's handing out gold-plated healthcare, which is what this is. I mean, it's really good coverage. It's not Medicaid. It's fee-for-service plus, which cost-wise, I've seen studies that show, legitimate, nonpartisan studies that show that'll be 70% higher than the Medicaid. Okay, so it's not just, you're a sanctuary state. When you're a sanctuary state and you're dangling, benefits that are better than the citizens of the state get, that's going to attract people, right? I mean, to put it in perspective, right? So in Medicaid, right? So if the state spends $1, 50% cost match from the feds, so the state, funds 50 cents. This program, which is 70% higher, that dollar becomes $1.70. There's no match. So the state's on the hook, or hospitals are on. Someone's on the hook. It's not like these expenses aren't taking place. So if the state's footing the bill, that makes this program 3.5 times expensive as Medicaid.
So again, State Senator Jason Plummer sharing some of his thoughts about the program starting July 1st being suspended for people between the age of 42 and 65. But the program for 65 and up, that's still allowed unless it gets over a certain threshold of, I think, like around 16,500 that take part in that. So you can see that the costs are obviously continuing to balloon, and that's led to the governor trying to limit those costs. But should this have been more apparent before they actually opened up the window for non-citizen health care to be subsidized by taxpayers or by hospitals ultimately, that then pass that down to the ratepayer, the citizen who's going to get those services. So we'll watch this closely. Of course, the budget begins July 1st, and how this ultimately could morph and change. We'll be watching that, and keep it here with Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY, Springfield's News and